Hello, my name is Mariam Shadru. I am going to change the wound dressing for my patient today, and for that I start with checking the doctor order. In the order it says dressing change once daily and PRN, irrigate with 30 milliliter normal saline, pack with 4x4 gas soaked in betadine. Okay, first I apply hand hygiene. I go to the bedside. Hello, my name is Mariam. I'm your nurse today. Can I check your wristband? Thank you. Would you please tell me your name, last name, and also date of birth? Perfect. Thank you so much. Okay, Alina, how are you today? Are you well? That's perfect. What I'm going to do today is to change your wound dressing and pack it with a new. And also, can I ask if you have any allergy? No, that's great. And also, what is your pain between 0 to 10 today? 2, that's okay. Would you need to go to the bathroom to eliminate the bladder? No. Okay, perfect. So I just apply hand hygiene again, and also just before that I bring the bed to the level that I can work properly. I have all the things I need, the dressing tray, the sterile part, and also, yes, I just provide the privacy, closing the curtain or the door. I apply my gloves. For this, the gloves doesn't have to be sterile. These are normal gloves, and I only undrape the part that the wound is there to make sure that the privacy of my patient is intact. And also at this point I put the absorbent pad under the wound and the basin to collect the saline and also the drainage. Okay, now I am going to remove the dressing, untape it. Okay, I check the dressing for the drainage, the color of the drainage, and also the odor. The color can be serious, can be watery, or sanguineous, serosanguineous, or purulent. And before that I make sure that I also have my garbage back here. Okay, and okay, now I just dispose it with the gloves. Okay, I apply hand hygiene and apply new gloves. After that, I would like to inspect the wound for the appearance, drainage, and also the integrity. For the appearance, I try to check the width, the length, and the depth, and also if there is any foreign body in the wound, and the peri-wound, the skin around the wound. Also, what is the color? Is it red? Is it yellow? Is it scar? That it is black. So I also, for the integrity, I check if the skin is fragile or is it intact properly. For the drainage, I check the amount. Is it scant? Is it moderate or excessive? And also again, serious, sanguineous, serosanguineous, and purulent. And now I start to use my sterile. So I take the forceps, and with the forceps, what is so important is that it wouldn't be contaminated, and my sterile location would be the center of that. So I try to put everything in the center. Okay. just put it here at the side. That is only at the end of the forceps is out. What I need now is the normal sailing. I'll just make sure that I have these out. Okay, I put the 30 milliliter sailing here. I also put the betadine. And I take the previous in the wound out and dispose it in my garbage. Okay, put it here, and then I take my syringe, and for the 30 millimeter, I do it from up to down one time, and the second, and the third time to irrigate the wound properly, and then I clean it and dry it. To clean it, what is important is that we would do it from the less contaminated part to the most contaminated, which is from inside out, and I dispose it, and then from the inside out again, dispose it. This part inside out. Okay. Okay, and to pack it, I would need betadine, and the other, I use the other forceps as well. I put it in the betadine, my gas, 4x4 gas. I put it inside the wound. Again, I've put the 4x4 gas inside the betadine, and then I put it inside the wound. Another one. Okay, make sure everything is okay, and then I apply the new dressing. Now I need to secure it with the band, with the tape. At this point, I just dispose everything. Put this inside this. And then I apply hand hygiene. Okay. I ask my patient, how are you? How was your pain? That's good. It's not much. So I'll put you at the comfortable position. Are you comfortable now? That's good. I lower the bed and also secure the bed tray, and then I go to document. Thank you.